In his 1945 Nobel Prize acceptance speech, Sir Alexander Fleming, the discoverer of penicillin, gave the world a warning. It was delivered at the dawn of the antibiotic era, when humanity first began to witness miraculous triumphs against the bacterial infections that had plagued countless generations of its species. The warning presented a terrifying reality, that bacterial resistance could undo the miracle of antibiotics. Antimicrobial resistance, or AMR, is when microbes adapt to survive in the presence of antimicrobial drugs by changing their genetic makeup. When antimicrobial drugs, like antibiotics, are used inappropriately, more and more of the microbe population becomes resistant, which means it is going to be harder to fight them off with the same drugs that once would have worked really well. As time went on, and the world of medicine evolved along the incredible pathways that antibiotics charted, our reality became closer and closer to the one Fleming had cautioned. Resistant strains of bacteria that were once easily controlled by antibiotics showed up in droves. Their resistance grew stronger, and though there have been plenty of innovative changes to the antibiotics we use, the only sure-shot way to stay ahead in this fight is to prevent bacteria becoming resistant in the first place. So, how do we do it? Well, the answer to that, in broader terms at least, is something medical science already agrees on. Preventing resistance consists of measures to: number 1, reduce the number of infections that would need treatment with antibiotics, for example, by practicing hygiene or getting vaccinated. And number 2, using antibiotics responsibly when they are needed, to ensure that the dosage is proportionate to the infection it is treating. But despite these measures being widely promoted, drug resistance remains a growing threat. In her recent paper, Dr. Esmita Charani and her team ask us to look beyond the biochemistry of the story to understand why.
Human behavior around infection and antibiotic use often doesn't conform to published guidelines or policies or expectations in public health advice. But this doesn't mean that patients or healthcare professionals are being careless. The reasons behind these behaviors are more complex. And what we need is a better understanding of what informs these behaviors in order to be able to tackle antimicrobial resistance. Until we do this, we cannot overcome the threat of antimicrobial resistance.
Let's take an example of inappropriate antibiotic use. When health systems charge high fees for consultations, poorer patients tend to rely on community vendors to get their medicine instead, buying whatever amount that they can. Self-medicating with antibiotics like this often fails to follow a responsible course, allowing resistance to develop. Now here we see AMR being driven not by irresponsible behavior, but from the consequences of the contexts in which people live. To more deeply understand detrimental health behaviors, Dr. Charani proposes the use of something called the Intersectional Approach, which recognizes that the different factors influencing behavior don't work in isolation, but are actually connected. By charting these different factors and the intersections between them, we can come up with much more effective solutions to the drug resistance issue. Going back to the example of self-medication, plenty of factors can intersect with a person's economic situation to influence their choices. For example, people with low health literacy may not understand the importance of completing their antibiotic dose. Consequently, they'll be less willing to spend limited money on antibiotics. People that are in insecure employment are unlikely to receive sick pay if they are absent for health reasons. This increases the chances of workers seeking quick fixes, such as using inappropriately strong antibiotics, which also drives up resistance. Gender inequity, family dynamics, health systems, culture, and countless other factors will also intersect to influence people's health behaviors. Appreciating exactly how these influences work will allow us to reach the root causes of AMR, and coordinate strategies across multiple relevant sectors, such as health, women's empowerment, labour and education, to deliver comprehensive solutions to the drug resistance issue. Doing so will be critical to keeping the miracle of antibiotics alive.